Hi everyone. Today I'm joined by Paul Geisel. Paul is an aged care expert. Welcome, Paul.
Yeah, thanks a lot, Billy. Good to be here.
A quick disclaimer, Paul and I have worked together in the past, and it's a small industry, financial planning, financial advice in Australia, and we get to cross paths, which is one of the best parts of our profession. Paul, as we've often talked about over the years, financial planning for the future, starts off with saving money for your first car, and then for a house, meeting your life partner, having kiddies, paying the house off, getting ready for retirement. What happens after that is often not discussed. What is aged care, and what should our clients be thinking about when it comes to themselves or their own family? Over to you.
Yeah, thanks very much, Bill. It's good to have the opportunity to talk to your clients. Look, aged care is all about planning and planning for the future. And as you said, typically in financial planning, we get to a stage where they retire, they get the caravan, and we set up an income stream and off they go. But at some stage they get sick of doing that, or someone gets ill or whatever, and there's a need for someone to go into aged care. So it's planning. And the disturbing question that I ask clients, particularly the children of elderly folk, is what impact will your parents or grandparents have on your retirement? And when I say impact, in terms of financially, physically, geographically, and legally. And of course, financially, so if you're retiring, will you be contributing to your parents' aged care needs? Physically, do you need to live close by and go around and see them every second day, weekly, or whatever? Geographically, if they're in Hobart and you're up here, do you have to move down there or vice versa? And of course, legally, which is a very important one, there's no time like the present to make sure your estate planning is up to date. And while your elderly loved ones have mental capacity, make sure they've got a will, make sure that they've got enduring power of attorney and advanced health directive. And if you do that sort of planning, well, you're in good stead.
What are the common challenges that you see, and why do people come to you for aged care advice?
Yeah, good question, Bill. Look, our offering it's a one-stop shop in aged care. So there's 4 offerings that we have. If people have been ACAT assessed and they want to stay in their home, and most people do these days, we will help them find a provider to give them that care in their home, whether it's Blue Care, RSL Care, Auscare, or whomever. When the time comes that they have to move into residential aged care, well, we can do that as well. So we'll usually find 2 or 3 homes that can accept them in the geographic area that they want. We'll do the negotiations and do a lot of the paperwork and whatever to help them move in. And then thirdly, people don't know about the funding. So we can do a full financial report and give them between 3 and 5 options on how they pay their upfront and ongoing care fees. We look at their pension and all sorts of things. And then the 4th thing is mediation. Now, I am qualified in a number of areas, not as a mediator, but in mediation, I'll go and see mum or dad at their home, so long as there's a family member there, have a cup of tea with them and just let mum or dad know what their options are to make it a bit easier for the family down the track.
That's excellent. So you provide a very supportive, almost a mentoring role during a potentially very difficult, challenging process. And do you also help clients to have challenging discussions?
Absolutely. No, absolutely. You must have that discussion while they're, as I said, still got mental capacity and they're still living together. You cover off on all the what ifs. What if mum gets sick and has to go into hospital? What if dad gets crook and has to go into care? What are your wishes? What would you like us to do as the children? All sorts of things. And if you have that conversation early, it just makes the process a lot simpler down the track.
It's good to be able to share this with everyone, because you've been able to help a number of our clients relieve a lot of stress at that challenging time of life. And when family is involved, it adds that additional layer of, I suppose, sensitivity and complexity. So what's a quick tip we can take away from today?
Quick tip, when your elderly folk are going into care, don't sell the home first. It just cuts out about 3 or 4 options. So come and talk to a specialist in aged care and get advice, and so you can make informed decisions.
So in other words, don't shoot from the hip and aim later, maybe aim
That's
first.
It.
Okay.
Exactly.
All right.
That's it.
Have a good week, Paul. Thanks for your time.
Thanks, Bill, and to you.